Hi everyone, Liam here. I'm the CEO and co-founder of Kaiterra. I'm an advisor on several of the International Well Building Institute's advisories, WELL Faculty, but most importantly, I'm just a huge fan of the well building standard, and I love what is being done there. Now, our company Kaiterra provides air quality monitoring solutions, specifically for well projects. And so, over the years, I have talked to a lot of well APs, and I spend a lot of time sitting down and working with them on certification and specifically on the air concept within that. And over the years, I've kind of been keeping a running checklist of various things that I thought would be valuable to share with the broader community and with many APs out there, or with people that are thinking about becoming a well AP. So we designed this series really to be a place where I could just share all of those insights that I've been keeping track of, and hopefully provide value to all the well APs that are out there, people that are considering becoming a well AP, and really just help people understand a bit more what goes into the air concept, why air quality is important, and how you can help your clients or your projects to maximize their score using this concept. So this course will be broken down into a series of episodes, and we'll be covering everything from the basics of why air quality matters into the really, really nitty-gritty of how to maximize scores, different paths to achieve points, and so on. So hopefully this will provide a ton of value. That is my goal, both to people that are considering becoming an AP and also to the seasoned experts out there that already know just about everything there is to know about the well building standard. So with that, let's jump right into episode 1. Episode 1, why air quality matters. When most people think about air quality, I think they think about outdoor air pollution. But there's actually a whole other side to the story that is really, really important, and that is indoor air quality, the impact that it has on our health, our well-being, our comfort, our performance, and it is incredibly important. In fact, this is why WELL has air as its own concept in the standard, and I don't know if this is the real reason, but I'm going to argue the reason why it's number 1 at the top of the list, because it is so incredibly important. You can survive 3 weeks without food, you can survive 3 days without water, you can only survive for about 3 minutes without air. It is fundamental to our existence as human beings. It really matters. And the well building standard recognizes that. Nearly a third of the 120 feature strategies within the well building standard are around measuring, monitoring, optimizing, and ensuring that a building has clean air for its occupants. So let's look at some statistics. Here is a chart. On the y-axis, you'll see, say, various sources of human suffering, for lack of a better term. And these are, on the x-axis, what you see is the number of deaths or premature deaths caused by each of these sources. Now, I'd just preface this by saying that this comes from a variety of different sources. These are averaged over the long term. This will change year to year, but I think it provides a pretty good picture. So you'll see terrorism comes in at about 25,000 deaths per year. These numbers are global numbers. War, about 50,000. Opioid overdose, you can see the numbers are starting to go up. Homicides, almost 500,000. HIV/AIDS, very serious problem. A lot better than where it was, but it's a very high number. Malaria, we're slowly creeping up towards about 3 million. Obesity, almost 3 million. Air pollution, so many that it's not even on the chart. I had to rescale this entire chart to fit this number on here. Air pollution leads to more premature deaths, approximately 7 million, than all of these other sources combined. That's crazy. This is having such a huge impact on the lives of so many people, yet it's really not being talked about anywhere near as much as it should be. And here are just a handful of other statistics to prove my point. Air pollution, again, like I said, it's responsible for more deaths than all those sources I just gave you. 18% of all deaths in India, it's about 1.7 million, this is in 2019, 18% of all deaths in India were linked to air pollution. Polluted household smoke is the #3 cause of early mortality for women. Girls exposed to high levels of PM2.5, particulate matter, are more likely to start their periods early. Long-term exposure to air pollution from heavy traffic is linked to higher infertility. Exposure to polluted air is linked to 1 in 10 cases of lung cancer in the UK. And starting in 2013, air pollution was cited as a cause of death for the very first time, officially on a death certificate. So a lot of these statistics and these stories might sound or feel like they're happening far away. Maybe they're not in sort of our home or our community. But the reality is, according to the WHO, only 0.01% of the entire global population breathes healthy air. That is a crazy statistic. So if you're watching this video, it really doesn't matter where you live. If you are watching this video, I can virtually guarantee that the air that you are breathing is not healthy, it does not meet WHO guidelines, and it is negatively affecting your health and your well-being. So this is something that we should all care about. Okay, that was a lot of bad news. There is a silver lining. There is good news in all of this. The good news is that air quality is a 100% fixable problem. We spend 90% of our time indoors. Almost our entire lives are spent inside buildings. And buildings are environments that we have full control over, right? From the engineering, from the design, from the choice of materials that we use inside buildings, we have complete control over these structures because they are man-made. And that means we can actually fix all of these things. In fact, we know what we need to do. There are very clear strategies that lead to a healthier indoor environment. And those strategies, of course, I'm going to bring it back to WELL here, those strategies are outlined in the WELL building standard, right? If you just follow that checklist and you go through all of the features in the air concept, you will end up with a healthy indoor environment. And as I just mentioned, the impact on our health is enormous. So this is something that I believe we really, really need to focus on. We can filter our air, we can choose different materials to use, we can bring in outdoor air and clean it so that indoor pollutants are not going to levels that are too high. These are all things that we can do. It is 100% fixable. And so, and this is the crazy thing. If you're a WELL AP or if you aspire to become a WELL AP, then this is your moment to make an impact, right? It might sound crazy, but I truly believe that your building designer, your building engineer, your architect, and your WELL AP can have a bigger impact on the health of occupants than the occupants' own doctors, right? And if that sounds crazy, just look back at the numbers that I shared a moment ago and the impact on our health that air quality has. It is crazy. It is a really, really outsized impact. And again, if you're a WELL AP, this is your chance to help guide your clients, your company, whoever is making the decisions around this project or this building that you're working on. This is your opportunity to guide those people and help them understand the importance of air quality, help them understand what the effective strategies are that will lead to a healthier environment. And ultimately, this is your chance to make decisions that will lead to healthier outcomes, healthier workplaces, healthier buildings, healthier residences for a potentially enormous number of people. So that's why our quality matters. Now, if you found this interesting, hopefully you did. There are going to be many more episodes like this. This was the overview, and in upcoming episodes, we will be getting into the nitty-gritty of every single feature, the pros and cons of different options, and discussing how to maximize points for a building in the easiest ways within the air quality concept.